Dartmouth Hitchcock Medical Center was selected as a pilot site for a nationwide anti-stigma initiative. Lauren Chambers, their senior community health partnership coordinator for population health at Dartmouth Health, is coordinating the initiative and joins me now. Welcome to the show.
Hi, thanks for having me.
So there's no hiding from the obvious addiction issue that New England faces. It affects people across the region, and cases like Purdue Pharma reaching the U.S. Supreme Court of late have reignited conversations on this issue. Dartmouth Hitchcock Medical Center has been selected to pilot this program, be a pilot for this program, working with the Addiction Policy Forum. So what does a campaign of this nature entail, and how does it work with this organization?
Yeah, so this is a two-phase pilot study that we are working with the Addiction Policy Forum on. We're one of over 100 sites across the country that were chosen to participate in this pilot, including at least 4 or 5 other sites in New Hampshire as well. So it's a two-phase project. The first part of it involves a new community survey about addiction that the Addiction Policy Forum created. And so we're deploying that in the community. We're trying to get just the general public, residents in the areas that I serve, especially, to take this survey, which will really give us a good baseline indicator of, the knowledge around addiction, attitudes and perceptions. And then what we get back from the Addiction Policy Forum is a report, hopefully, that will then show us what levels of stigma might be in the community as it relates to those questions that they ask in this tool. And then we'll be able to use that to really target our interventions and strategies, education and advocacy efforts where it's most needed. So that's the first part. And that's a tool that is in test mode. So this is something that they developed using a compilation of other survey tools and research best practices. So they are using this pilot as a way to test the survey to see if it really indicates what they're hoping. And then the second part of the pilot program involves a training that we'll be able to offer to anyone. It's good for the general community, general audience member. The training will then focus on trying to increase knowledge about addiction, increase knowledge about evidence-based treatment and recovery supports, and also really wants to build the skills in people to feel confident to help someone who might be struggling with substance use disorder, which in turn, if we're increasing knowledge and building those skills, that in turn they're hoping will reduce the stigma potentially in the community. So again, this training is also a tool that they're testing out. And so we'll be involved in delivering the training, testing it out, getting some feedback from participants, and then they hope to show that the training is effective in increasing knowledge and reducing stigma. So that's the two main parts of this pilot program.
Can you speak, maybe, it's always good to define words, especially when you're setting policy or trying to set company policy with regards to it. So when you say stigma and reducing stigma, what are some examples that kind of highlight what that means in this situation?
Totally. Stigma can apply in different situations, but what we're talking about here in terms of stigma towards substance use disorder, it's basically any perception that someone with a substance use disorder is less than, is unacceptable. And this really leads to shame and judgment and prejudice and discrimination towards people. And that is a real, it's shown in research to be a real barrier to people seeking treatment. If they don't feel comfortable approaching or asking for help from anyone, especially the healthcare system, then they're not going to do that. And that prolongs their use and delays seeking treatment. And we know, the earlier people seek treatment, the more chances they have of a successful recovery. So that is the reason why stigma is such a big deal in terms of substance use disorder.
So So what's the goal ultimately when it comes to like having these initiatives? First of all, I want to say I love the fact that this has a huge data component. That's something I feel like is glossed over a lot with a lot of other initiatives that kind of, when you look at the headlines, kind of look like this. This looks like a very different program, which I'm very happy to see. There's data and evidence-based solutions is the goal to come out of this, which is fantastic. I mean, do you, going into this, do you have any sorts of ways that you're envisioning the program will change the way that your institution is currently handling this situation?
Yeah, I hope so. I sort of, my role on a broader level within DH, I do a lot of community facing work. So my role is not just working internally with the Dartmouth Health system, but it's more so focused on working in the communities and with community organizations and the general public. So, and my hopes in applying for this pilot program was that I could bring more anti-stigma efforts into the community. I think some healthcare institutions are working on this internally as well and doing a good job. We're trying to do things at Dartmouth Health. I know lots of departments are working on stigma always. It's always a topic of conversation. It comes up in every meeting. But I'm really hoping to bring this pilot and this training into the broader community, to people who maybe don't have access to or background or training in education about addiction, so that we can increase their knowledge and their skills to be able to help others. And hopefully in turn, this takes a long time because it's a whole culture shift, but in turn, hopefully that reduces the stigma that people might feel for if they have substance use or mental health or any other kind of behavioral health condition. So that's the main goal, really. It will take a long time for sure, but this is just one step. So I hope that people are interested in taking the training and that it is effective, and we'll see.
Yeah, I mean, and I'm assuming the goal of this ultimately is to bring down the addiction numbers overall across the region. I feel like that's something that's glossed over. To get minor political for a moment, I mean, with a lot of the harm reduction programs that have been highlighted a lot in the press, it's not necessarily the focus is to stop the addiction problem. It's kind of like peripheral. We want to funnel people towards getting that. Like, is this a little more directed at trying to stop the addiction that's in place?
I would say that indirectly that's our hope.
Mm-hmm.
But ultimately this type of pilot, this anti-stigma pilot, in terms of doing the survey and doing the
Mm-hmm.
training, is going to be mostly geared towards people in the community that do not have addiction or maybe aren't dealing with it, but could have friends, loved ones, neighbors, coworkers who are dealing with it. And so this will hopefully strengthen the support that they're able to offer people that they interact with in their life, which will then have an indirect effect on that person, maybe asking them for help, maybe reaching out to a healthcare provider and seeking treatment, again, which in turn will hopefully improve, substance use disorder data and, the number of deaths and whatnot in our state. So it's all like a snowball effect.
Yeah.
But it's an indirectly going at it a different route versus just directly working on strategies and initiatives for people who have substance use disorder. It's going an indirect route and sort of strengthening the community around them to hopefully encourage them to reach out for help.
So what do your programs look like right now that you're doing with regards to addiction over at Dartmouth Health?
Oh, there's so much. I could not even possibly list everything. Just to touch again on my role specifically as working more so with the community, I am part of the 2 regional public health networks of the state. So New Hampshire's broken up into 13 regional public health networks, and Dartmouth Health happens to hold the contract for 2 of those regions, the Upper Valley and Greater Sullivan County. And so one of the roles in that contract is what's called a continuum of care facilitator. So that's my role. That's my official title. And so I get to work across the entire continuum of care for substance use disorder, from prevention through recovery, doing a little bit in each of those realms in terms of strengthening the systems, raising awareness and improving access to those systems. I'm not a direct provider. I'm not a clinician. I don't do any direct services with patients or clients or anything like that. But my role is more so behind the scenes, I'd say, in supporting those people and those organizations that are doing that direct service so that they can focus on that good work. And I sort of can support them with background things such as trainings. A lot of things I do are different trainings: mental health, suicide prevention, harm reduction, Narcan trainings. I do a lot of that. So that's just that my role is more so community focused and strengthening the systems. But there's tons going on in the medical center itself that are more clinical. We have the Doorway in Lebanon, and there's tons of great stuff going on in OB and the Moms in Recovery program. And there's just so much. I could not possibly name it all.
Well, it's good that you got that many because it's so important. It's such an issue. It's like I brought up at the beginning, like with the Purdue Pharma cases coming to the Supreme Court. It's really hopefully going to start opening people's eyes again to this. Hopefully it'll mean there's some more funding that'll be coming down the pike over the next couple of years. And I mean, with this anti-stigma program, what's the timeline that you're hoping to begin to have data you can start utilizing? People say, oh, you're going to have it in 6 months. I'm assuming it's going to take a couple of years for there to be realistic data you're going to be able to utilize.
I don't know. The pilot itself is only, I think the Addiction Policy Forum, their timeline is only about a year, maybe a year and a half for the whole pilot. So I'm part of the first wave of this program. So the survey is live now. And so I've been getting the link out as much as I can into the community, and that will be open until the end of January. So once that closes, then we may have a community report delivered back to us within a couple months. That's something that the Addiction Policy Forum is doing for us as part of the program. So they provided the survey. They're going to analyze it and send us a report. And then they're going to be training me to be an instructor in the community training. And that's something I will start to roll out, hopefully early spring next year, I think. Wow. Yeah, well, so pretty soon. Yeah.
Yeah, that's awesome. Yeah, we every community, especially in the Northeast, really needs service like this. I'm happy to see something like this going on, and especially, once again, data to show what needs to happen so we can make sure people are getting the help they need. Lauren, if people want to learn more about what you guys are doing at Dartmouth Health, where should they go?
They could email me. I can provide my email, and or they can check out more about this pilot initiative. I know that there is information on the Dartmouth Health website about this program and a link to the survey, so they can go on Dartmouth Health and probably do a quick search on the website and find the survey pretty easily. And people can always connect with the regional public health networks. There are 13 of them in the state, and so there's someone like me in every single one of those. And you can find information about the regional public health networks online as well, and find contact information for whoever is in your region that you're interested in.
Awesome. Lauren Chambers of Dartmouth Health, thanks so much for joining the show.
Thank you.
So I'll be sure to put links in the episode description if you want to learn more about this program. And check out the NewEnglandTake.com. We got a brand new website we've been putting together. It is basically live. Go to NewEnglandTake.com. Like and subscribe, and we'll talk to you soon.